Hello and welcome to the Kantonspital Wintherthur to talk about fibroid therapies. Before we talk about different therapy options, I like to mention that fibroids are a very common disease. About 30% of all women have fibroids. Symptoms can be either strong bleedings, which happen during the menstruation. In addition, if fibroids are growing, they can push on other organs, such as the bladder, causing you pain and discomfort. Besides several surgical options, there are also established minimal invasive treatments. One of it is fibroid embolization. Fibroid embolization has about the same results as surgical therapies, but with less risks, no general anesthesia, and a much shorter recovery period. In order to better explain the procedure to you, I like to show each step on a small video. The first video shows you the location where the treatment takes place. It is called an angiographic suite. It looks very similar to operating theatre. However, it is dominated with a high-level radiological equipment to monitor every step of the procedure. The first step of the procedure is the application of local anesthesia in the groin. This helps to make the rest of the procedure much less painful. As soon as I have punctured the artery, there's blood coming back, and at this point a smaller tube is advanced into the vessel. Under the control of the radiological equipment, I can advance the catheter to the right spot where the actual procedure can be performed. The mechanism of embolization I like to show you first on a schematic drawing. First you can see the shape of the uterus, and within the uterus you can see a fibroid. As you can recognize that the fibroid is fed by larger arteries than the rest of the uterus. As you have seen before, we have advanced the catheter from the groin through the arterial system into the uterine artery. Once we have reached the right location, we can inject small particles through the catheter. The particles are automatically transported to the fibroid with the blood flow. The particles then block the flow to the fibroids, which cuts off the nutrition to the fibroids, leading to shrinkage of the fibroids. I'll show you now how this works in real life. You can see that we inject some dye through the catheter in order to visualize the fibroids. On the screen we can see a high uptake of contrast on the fibroids. You can see an intense staining of the fibroid, which demonstrates the high blood volume within the fibroids. The particles come prepared in a syringe, and we then mix them with contrast in order to visualize them during the injection. Once the particles are mixed, we can start injecting them through the catheter. We inject the particles under radiological control so we can see exactly where the particles go. Once we have finished the embolization, we again inject some dye to control the result of the embolization. On the next video you can see on the left side the angiogram before the embolization, on the right side afterwards. On the image before embolization you can see the intense staining of the fibroids, and after the embolization there is nearly no staining because the feeding vessels are blocked by the particles. It's important to embolize both uterine arteries. You can see again the intense staining before embolization and no staining afterwards. In order to minimize the pain which can occur once you block off the blood supply to the fibroids, we perform a so-called nerve block. In order to do so, I advance a thin needle just below the belly button towards the spine. Because the nerve fibers of the uterus are located in front of the spine. Once we reach the spine, we inject some dye in order to confirm the correct location, and then we inject a long-acting local anesthetic which blocks the pain signal to go to the brain. Doing so makes the intervention even more tolerable for you. At the end, I like to show you how minimally invasive the procedure is. You can see the small catheter in the groin and the small incision just below the belly button. After these technical aspects of fibroid embolization, my gynecological colleague will give you now some additional information.
Thank you, Chris. As a gynecologist treating uterine fibroids, I welcome the embolization as an alternative treatment modality, giving the patient a good minimal invasive procedure without removal of the uterus. Comparing the embolization with the hysterectomy, we will find comparable results on long terms. Furthermore, the embolization seems to be the better procedure compared with the removal of fibroids called myomectomy, because the embolization can act preventive on small asymptomatic fibroids and reducing the rate of recurrence therefore.
Thank you very much. I hope you have gained a better understanding of fibroid embolization. With this, I'd like to say goodbye to you and thank you for your attention. Vielen Dank für die Aufmerksamkeit.